This is the model showing the venous drainage of the upper limb. Upper limb venous system as well as the lower limb both has got dual venous system, that it has got superficial vein and the deep vein. Deep vein are those which accompanies the arterial system, like here is the subclavian vein, then comes axillary vein, then this is brachial vein. Brachial vein is first a single vein, then it divides into two like this. These are called vena comitatus. Its literal meaning is the veins which comes in pair and accompanying an artery, vena comitatus, and the pulsation of the artery helps in the venous return. So this brachial vein are in the form of vena comitatus. Now where it gives tributaries, that is divided into the vein of the forearm, that is the radial and ulnar, it becomes, here it is 2 in number, paired, then it becomes 1, and again here is 1 and 1, then again divide to form the vena comitatus of the forearm. Here is the vena comitatus of the radial artery, and these are the vena comitatus of the ulnar artery. So what we are seeing, the deep veins are those which accompany the arterial system everywhere. Here I have made one, that this is the, here is our superficial palmar arch and the deep palmar arch, and the venous system, superficial, the vein of the superficial venous arch and the deep venous arch, and these are the proper palmar digital vein, and this form the common palmar digital vein. These are the palmar arch vein, the superficial and the deep. So what we are seeing, the deep veins accompanies the artery, and the second one is the superficial vein. Superficial vein, it starts its journey from the dorsal venous arch. This is the dorsal aspect, and this is our, in white color, this is the dorsal venous arch. Okay, and this is our medial side and this is lateral side. So in the lateral side, this is the cephalic vein, and on the medial side it is the basilic vein. Cephalic vein, it starts from the dorsal venous arch, which drains, these are the dorsal metacarpal vein in white color, dorsal metacarpal vein, and these are the digital vein. It connects the deoxygenated blood from the digital vein to dorsal metacarpal vein, then dorsal venous arch. And now this is our cephalic vein, which is in the posterior or dorsal aspect and then goes on the anterior aspect at the level of distal end of radius. And this is the basilic vein, which runs on the posterior aspect, and at the level of the elbow joint it goes anteriorly. Okay. Now this is our cephalic vein, which is on the lateral aspect. It comes anteriorly, and this is, it comes anteriorly, and then where it is going, it is passing here in between the deltoid muscle, and this is our, here is our pectoralis major. So it runs in the deltopectoral groove and ends at deltopectoral triangle. Here is our deltopectoral triangle. Okay, and pierces the clavipectoral fossa and drains into the axillary vein. This blue one is our axillary vein. This cephalic vein drains into the axillary vein. And now what is the course of basilic vein? This is our basilic vein. It comes anteriorly on the ventral aspect at the region of the elbow joint, and then it runs and drain into the vena comitatus of the brachial artery, like brachial vein. You can say brachial vein, and then here it drains at the level of the lower border of the teres major. So this is our cephalic vein, and this is basilic vein, and this one which connects the cephalic vein with the basilic vein, it is a branch of the cephalic vein which connects the cephalic with the basilic vein, the two superficial vein of the upper limb. This is known as the median cubital vein. It lies at the level of the cubital fossa, and that's why this is called median cubital vein, a branch of the cephalic vein. And it has got very much clinically significant that it is commonly used for the venipuncture. You can say its function is VCR, not video cassette recorder. It is the venipuncture, cardiac catheterization, and the renal hemodialysis. But most commonly venipuncture for taking blood samples from here, as well as the cannulation is done for the IV fluid administration, blood transfusion, like this process most commonly used, because it is superficial level, it is easily accessible, it is somewhat wide, it is separated for the deeper structure by the bicipital epineurosis, which is also known as tendon of grace of God, because at this level below there is brachial artery. This red one is our brachial artery, and also median nerve, very important structure, and these two structure, that is the median cubital vein and the median nerve brachial artery, both are separated by the bicipital epineurosis in between. So we have to put the syringe of a needle parallel to the skin so that it can be protected. And so the bicipital epineurosis protects the deeper important structure, as well as this median cubital vein is fixed by the perforating veins. These two yellow one, these two are the perforating veins which connect the median cubital vein with the vein of the forearm, that is the radial vein and the ulnar vein. These are the yellow one is the perforating vein. Due to the presence of this perforating vein, this median cubital vein is fixed at this place, well anchored, so for easy for taking blood sampling or administration of the IV cannula. So this is the very important clinical significance of median cubital vein. And what is this? This is the median vein of the forearm. I have made superficial vein from the white color. So this is the median vein of the forearm. It runs on the ulnar aspect. It collects the veins, deoxygenated blood from the palmar aspect of veins. Here only one vein I have made, that is this is our proper digital vein united to form the common digital vein, superficial and the deeper arch vein, and now they are. So these venous plexuses, these are collected by the median vein of the forearm. This is forearm and it runs in the middle. So median vein of the forearm or median antebrachial vein, but it runs on the ulnar aspect. It collects the veins from the palmar aspect of the hand. Okay, and this yellow one, this is the perforating veins. Perforating veins are what? It connects the superficial vein with the deeper vein. Deeper vein are shown in the blue color. So perforating vein connect superficial vein with the deeper vein, and the direction of the blood flow is from superficial to deep. And deeper veins lie closer to the muscle. So contraction of muscle enhances the blood flow from deeper to superficial. So but it should not be there. So in the perforating vein there is so many valves to combat this venous reflex which is created by the muscular contraction. If this perforating veins, the valves become incompetent, this will lead to varicose vein due to the reflux of the venous blood from deeper vein to the superficial vein. And what in the normal condition, what happens, that the superficial vein, the blood will go into the deeper vein through this perforating vein as well as through the basilic vein, cephalic vein. All these are draining into this is the axillary vein. So this is the deeper vein, superficial vein going to the deeper vein. Here is also superficial vein draining into the deeper vein. So this is the system, that from the superficial vein first blood goes to the deeper vein and then it drains. The drainage system is from periphery to the center, that is centripetal, and the arterial system is what? Centrifugal, from center to the periphery. So this is all about the venous drainage of the upper limb. Thank you.